guys ready? Are you ready? Awesome. So appreciate everyone being here today. I think everyone was hoping that these COVID updates were gone forever, including myself, but hoping that the pandemic was actually coming to an end. I think now, as and we'll hear more of the statistics later on, I think we certainly know it's nowhere near the end. So as this holiday weekend kicks off, we want to take this opportunity to encourage everyone to enjoy this holiday weekend, but do it in such a way that is safe for them and their loved ones. We know you obviously will be gathering with your family. We are simply asking that you make really smart decisions when you are gathering with your family. So number one, if you're feeling sick, if you are feeling sick, stay home. Number two, get a test and ensure you aren't spreading COVID to some of your most loved ones. If you are vaccinated but haven't got the booster yet, get it this week. It's a great time to schedule that booster. I personally have scheduled mine. We want everyone to make sure that they are celebrating, again, as safely as possible. Also, Stroll on State is Saturday. I'm glad that it's a vast majority of it is outdoors and therefore a much safer event. Researchers have said that infections can happen outdoors, but the chances are massively reduced. Fresh air helps disperse and dilutes the virus. It also helps to evaporate the liquid droplets, which it is carried in. In addition, the Stroll on State team, who has been working tirelessly for about the last 8 months, have taken a number of precautions to make sure that this event is as safe as possible. So you're going to see a larger footprint, multiple tree lighting ceremonies, so everyone isn't just grouped into one area, a new time and location for fireworks, Santa pop-up visits as opposed to just one location, indoor and outdoor letters to Santa, and mailbox locations, and everything indoors will be requiring a face mask or face covering for all of the indoor locations, and additional space is also going to be provided for all the vendors, and a number of other enhancements. So if you feel comfortable, we certainly encourage you to come down and celebrate. But today we are really talking to you because cases are dramatically surging in our area. Our healthcare workers are tired. Our hospitals are getting overrun. And as we come on to Thanksgiving, Thanksgiving was my father's favorite holiday. And he routinely mentioned to us kids that attitude and gratitude are the two things that we can control. And that's how we should really hold on to those and live our life through those. So what I would say to people watching today, utilize attitude. We control that attitude, and for a long period of time, we have felt this malaise of COVID-19, but we alone can control how we move through and live with COVID. We can do all that is within our power, and that is wearing a mask, that's practicing social distancing, that's washing your hands, that's making sure you do get the vaccine if you're healthy enough to do so. That's making sure those of us like myself who are vaccinated get the booster shot, and that's making sure that you get tested when the healthcare professionals deem that the tests are necessary. We all play a role in that. And that's, my dad also said gratitude, and I would say I am incredibly grateful for people like Dr. Martell, people like Dr. Bartlett, and even more than them, those folks who are on the very front lines of all of our healthcare systems, those folks who are in the Walgreens stores helping us, everyone who's part of this healthcare system that is keeping and working so tirelessly to keep us healthy. Let's show them respect this Thanksgiving and show them how grateful we are by doing everything in our power to stay safe, everything in our power not to spread the vaccine. We want to spread the vaccine. We don't want to spread the virus. With that, I also have the honor of reading a statement from my good friend, Chairman Joe Chiarelli. And so the following is a statement from Chairman Joe Chiarelli, who I can tell you would absolutely love to be here with all of us today. After receiving a positive COVID-19 test on November 3rd, Winnebago County Chairman Joseph Chiarelli has been out of the office and under quarantine at his home. Only mild symptoms presented at first, but a week later, the chairman was taken to the hospital and admitted to the UW Health COVID unit. There, he was diagnosed with COVID pneumonia, was put on oxygen, and received several medication treatments to improve his condition. 3 days after being admitted, the chairman was released from the hospital and has been recovering back at his home. Health experts consider this a breakthrough case, as the chairman was fully vaccinated. He is no longer COVID positive or symptomatic, but he is operating on a reduced schedule while he regains his full strength. Chairman Shirelli thanks the community for their thoughts and concerns during this time and encourages the public to be vigilant and stay safe during this holiday season. I can tell you in my conversations with the chairman, I'd first say, as I did to him, we have a number of things in common. Probably the most apparent to everyone who meets us is we both married up. We have wonderful wives, and he has one of the best, and Connie Shirelli, and I hope everyone has their prayers and thoughts for the entire Shirelli family. To take his words to, there's a reason that he felt comfortable and compelled to provide a statement today. The magnitude, in such a personal statement, the magnitude of what's taking place today in our community is not acceptable, and we all can play a role in that. So please, take his words to heart. Be vigilant. Being vigilant is wearing a mask and practicing social distancing. Being vigilant is making sure that if you're able, that you get the vaccine. So certainly our thoughts and prayers are with the chairman. Next up, I have the opportunity to turn you over to Dr. Bartlett. And Dr. Bartlett is the Chief Medical Officer and Vice President of OSF Healthcare, St. Anthony Medical Center.
Thank you, Mr. Mayor, and thank you for that clarity. The story you told about the chairman is spot on, and a tremendous education about what the vaccine really means to the citizens of Winnebago County. It could have been very different had he not had the vaccine. We know that people who are being admitted to the hospital with a COVID infection are 10 to 1 people without the vaccine to that one who has had the vaccine. And those who have had the vaccine generally, as a rule, have a much milder course in their illness, just like the chairman had, where he recovered fairly quickly and is now regaining his strength at home. So it's a great story, and it's great that the chairman was able to speak out on that, because that really is the experience of what we're seeing in the hospitals now. We are having a COVID surge, and its timing is very similar to the surge we had exactly 1 year ago this time. It's not quite as severe as the one a year ago, but it has a major difference. And the difference is we're seeing younger people getting sick with COVID than we did a year ago when we had the same type of meeting, and we were talking about people who are in their 60s, 70s, 80s. Now we're talking about people who are between 30 and 50 who are getting the serious, severe COVID infection. And in the city right now, there are 2 infants who are severely ill with COVID. So we can't emphasize enough that we are in the midst of another surge. All the hospitals are operating very well. There continues to be capacity to take care of our patients, take care of patients with all the medical needs that we have. But as the mayor said, it's beginning to have an impact and stress on the healthcare workers and the nurses. We have, as some of you know, needed to recruit new staff because the nursing and doctor ranks were decimated by COVID. They're tired, and the public can do its part by getting the vaccine. The vaccine works. And I know the vaccine has become an enormously controversial topic. And one of the beauties of the United States is that we will defend to the death your right to express your opinion. We'll even defend to the death your right to be wrong. And to not get the vaccine is wrong. We need to be getting the vaccine and really make it so people are less likely to spread the infection and to when you do get a breakthrough infection, it's short and you're not likely to create an impact on others, the hospital system. This is something we can win, but it really depends on the public to do is what the mayor said. When you get together with your family, be smart. If you're ill, opt out of that Thanksgiving celebration. Stay away from the rest of the family. Get the booster shot. I think, as the mayor said, the booster shot is widely available now. If you haven't had the vaccine, get it. If you've had the vaccine and 6 months have gone by, get the booster shot. I got the booster shot the day it was available. It takes 5 minutes to get it. Just take your vaccine card with you and go to a pharmacy in the city, and with almost no wait, you can get the booster shot. Who's eligible for the booster? Anybody over age 18. We know that anybody with an illness or a medical issue over age 18 should get it. Anybody over age 18 who's otherwise well may get it. But we do recommend getting the booster shot. And if you've not had the initial vaccine, we again urge you to do that. The next thing I would say to you is flu has hit Rockford. It's now in Winnebago County. So everyone should be also getting their flu shot, because it's very difficult to distinguish flu from COVID infection, and they can coexist. You can get both at the same time. So we urge people to get the flu vaccine. Finally, if you believe you have the COVID infection or may have the COVID infection, the mayor is absolutely right. Get tested, determine whether you have it. It allows you to chart the course of the disease even if you're being treated at home. And should you get worse, you know what you're dealing with and you can get care right away. So we do urge you to see a healthcare provider, your physician, a hospital, a prompt care. If you are sick, get tested, and that will really help us manage this pandemic in Rockford. The last thing I would say is we're really proud of the great job the health department has done in Winnebago County in coordinating all 3 hospitals and really giving an extraordinarily strong response in this county. So, Mr. Mayor, I'll turn it back over to you.
Thank you. Thank you, Doctor, and pretty alarming information, right? What we heard is we have 2 infants who are struggling right now with COVID. We still have folks in their 70s and 80s, but also it's running rampant in folks between their 30 and 50s. So that's pretty much everyone here in our community needs to be vigilant when it comes to fighting back against COVID. Also, we heard pretty loud and clear that it's 10 to 1 those who are getting COVID. 10 being those who are unvaccinated and 1 those who are vaccinated. So please, I know most of you don't listen to me, so please listen to someone who actually has a medical degree. So again, please be cautious and vigilant. Next up, we are really fortunate, just as Dr. Bartlett mentioned, our health department has done an incredible job during really difficult times, and that's under the leadership of Dr. Martell. Dr. Martell?
Thank you, Mario. Thank you, Dr. Bartlett. And thank you, all of you, for coming and helping us bring attention to this. You know, when I think about what was different a year ago, we didn't have the therapeutics we had, and we didn't have vaccine. And so it's kind of a very challenging time when we realize we do have those now. So as I start to talk about some of these cases, we've been talking about Winnebago County being categorized a high risk of transmission now for almost 2 months. It's kind of like we're blowing through every stoplight. Our transmission rate is 502 cases per 100,000. Our positivity rate is over 10%. Currently, we have 126 individuals hospitalized. We had a kind of a 3-day total reporting 539 cases from Saturday, Sunday, and Monday. And we have a low vaccination rate of 61.4%. You've heard from our physician. With the increase in hospitalizations, our emergency departments are full, and hospitals are once again having to modify visitor policies and asking individuals to use their primary health care and urgent care. It's saddening to hear that we have 2 infants. And while we are all high in that sense, in terms of high transmission, and so maybe people have just stopped looking at the stop signs, maybe they've just totally ignored it. And I hear, well, how are we in relation to other counties? So I'm going to give you a little perspective. And I normally don't do a lot of comparison because I'm responsible for Winnebago County, but I'm going to give you some comparison statistics because I often hear it's because we have the city of Rockford. I'd like to say that, is an easy solution, but it's not. Look at Cook County. They have 5.1 million in population, which is 18 times more our population. They have 171 cases per 100,000. Compare that to our 502. Their positivity rate is 2.5%. Ours is 10.1%. They have 441 hospitalizations. We have 126. Their percent of population vaccinated is 74.2%. DuPage County, we'll go with Naperville being a large city. They have almost 1 million in terms of population estimate, about 3 times our population. Their case rate, 212 per 100,000. Their positivity rate is 3.7%. They have 84 hospitalizations. Their vaccination rate is 80.4%. Now we'll go over to Kane County with its city of Elgin. They have about 500,000 population. It's about 2 times our population. Their case rate is 216 per 100,000. Their positivity rate is 4.9%. They have 56 hospitalizations being reported for the same time frames. And their population is 71% vaccinated. So what's the difference when you look at all of that? We all have great health care and hospital systems. We all have access to vaccines. We all have the same contact tracing programs. We have the same capacity to test. What's the difference? The percent vaccinated. And while breakthrough infections do occur based on our contact tracing data, the majority of hospitalized cases, as Dr. Bartlett alluded to, have been unvaccinated. Currently, when we look at our data, and we really looked at data going back from December of last year through the time frame when vaccination started, only 13% of individuals who've been hospitalized have been fully vaccinated. So the majority have been unvaccinated. And we have to be clear about that. Breakthrough infections is not a reason to not vaccinate. And we understand that immunity is waning. We have the approval of the booster doses for everyone 18 years of age and older. If you've been 6 months since you got your second dose of either Pfizer or Moderna, it's time to get it. If it's been 2 months since you got a Janssen or Johnson & Johnson, get your booster shot. So what are the other contributing factors? Well, today's a perfect example. Sunny and cold. We've moved indoors. But I also have to acknowledge that there's been a poor adherence to indoor masking. At the beginning of the pandemic, I got calls from the public about businesses. Now I've got businesses calling about the public. They're having a hard time. They have signs up. We have a mandate in the state of Illinois. Indoor masking is necessary given our high transmission rate. Isolating when sick. I think it's disheartening to find out people have gone into their workplaces or school knowing that they were not feeling well, knowing that they were ill, and then exposing others. We've had a hard time getting people to understand that you need to quarantine after an exposure. That means no shopping, no sports, no going to the movies. It means staying at home and staying contained so that you cannot potentially transmit the disease. So we need to make sure that people understand that the same things need to apply that did last year. Gathering of unvaccinated individuals. This is not the time to be hosting banquets and parties and things where you have a table full of unvaccinated individuals who take off their face coverings and eat and talk. That's one of the highest risk activities we've talked about before. And I want to keep reiterating, vaccinations continue to be highly effective in preventing transmission, hospitalizations, death. And we have more than 12 months now of data on safety and efficacy. So that excuse is out the door. Vaccinations are safe, effective, and available. And by available, I mean free. So I've also heard some of the excuse, well, we're just going to be endemic. We're going to live through this. It's not going to be a big deal. Well, while we understand we may not be likely to eliminate COVID-19, I think we need to understand that the goal is to reduce the impact of COVID-19 on our daily life by controlling it. As the mayor referred to it, it's attitude. It's not endemic yet. It is still controlling our lives. It's still controlling our businesses, our schools. And so we need to get control. We need to mask up, we need to wash up, we need to back up, and we need to vax up. Vaccines continue to be our best strategy ending this pandemic. So as we go into the holidays, again, we want to talk about being as safe as we can possibly be. And the risk, again, is associated with individuals coming from outside your household and removing masks to eat and drink. But there are safer ways to celebrate. Remember, we have to protect those not yet eligible for vaccination, so our children under the age of 5, so our new infants, our babies, our toddlers, because we have to vaccinate around them. So eligible adults should continue to vaccinate. Masking indoors when individuals are outside of your household. I know that seems like an odd hostess kind of activity, but we have to be serious about this. At over 500 per 100,000, the safest, nicest hostess gift you can give someone is to not potentially bring an infection into their homes. Seat households together. I always laugh in the day when I was young, we had the kid table. Some of us were out in the garage, some of us may have been in the basement.
Still have the kid table.
Yeah, so where can you seat individuals together safely? Households. Outdoors is always safer than indoors, so even opening your windows and your porch doors and things like that to increase ventilation. And please, please, if you are sick, do not host or attend gatherings. I know that everyone has been so excited. They can't wait to see everyone, but now is not the time. Remember to review the guidelines for travel. We have said before, the safest way to get someplace is in your own personal vehicle, but we understand that Wednesday looks like one of the highest travel days since pre-pandemic levels, so follow the CDC guidelines for travel. And as the mayor indicated, consider testing before gathering. Now, again, when you talk about testing, you want to do it as close as you can to the date of the event. The challenge is, if you've got antigen testing, that might be Wednesday. If you're talking about PCR testing, you're going to have to take a look and see what days and times things are open. But if you're an unvaccinated individual, consider testing before you go to your holiday gathering. But we do want you to enjoy the traditional celebrations of our season here. It's a beautiful time in our region. We have the festival lights at Sinisippi. It's completely safe. You're in your car, you're in your own area, it's outdoors, you can open up your windows. And Stroll on State. We have worked very hard with that committee to review the guidance and make sure that we are looking at all the ways that we can make this a safe and fun event as possible. So in closing, it's time to double down. It's time to double down our collective efforts to move this pandemic to an endemic status, to protect our business community, our educational systems, our families, and ourselves. Mask up, wash up, back up, vax up. Thank you, and I want to wish all of our community a healthy and happy Thanksgiving holiday. And with that, we'll be happy to take questions.
Mr. Martella, I know there's, the closures and things like that, mitigations are made at the state level, those decisions. But with the surge here in Winnebago County, could that be a reality again, where we see crowd limitations and potentially restaurants closing down?
Well, the question was whether or not that we would see closures issued at the state levels and things like this. I think there's growing concern that, again, we are going to have to take a look at it. And you see some of our businesses are trying to do it themselves. Right, they're trying to really enforce the guidance. We talked about making this as safe in terms of when you think about going in and Stroll and State in the restaurants, keeping that outside serving area, keeping as many people outside as possible rather than clustering in the wait areas, respecting our businesses. They worked very hard throughout the pandemic, and it was a very difficult time for them, for individuals to go in and politely decline to wear a mask when they're wait staff or when they're it's being served, creates a difficulty for them. We already know the pandemic has already, I'm going to say, created a disemployment. We've got many individuals are not returning to the workplace. So many of our businesses cannot find enough help, and there's growing concern that when they work in a particular environment that they'll be exposed. And so it's our job to wear a mask when we go into those facilities to protect our business community.
Dr. Martell, do you expect to see any kind of surge following the stroll on state this weekend?
So the question is, do I expect to see a surge from the stroll on state? And the answer is no, I do not expect a surge from stroll on state. We've not seen a lot of super spreader events. What we're seeing continues to be smaller groups that get together and a high transmission among the unvaccinated within that particular group. So do I expect to see a potential surge after the Thanksgiving weekend? Yes, I do. But do I expect to see one associated with a particular event? No, I do not.
Going back to the question about potential closures, is I know early first case before and even had stricter policies, especially when it came to gatherings in the county opposed to the state and the country. If the numbers continue to go the way that they are right now, would the county consider stepping in and putting in our own type of restrictions?
The question was whether did that in the past, and if you recall that at that time it was because we knew we could only contact trace a certain number and we knew what our staff was. We now have different capabilities. We have what's called a surge center throughout the state, so we can call on those resources. I'm hoping that people get it, that we don't want to close down. You didn't like close down. Nobody liked it. The businesses, the people, I didn't like it closed down either. So what are we going to do? It's, I'm going to say not only is it attitude, it's action. What are we going to do to protect our community and keep it open, to keep our stores, to keep our restaurants, to keep our sporting events in session, to keep our schools in session? We have blown through every warning light possible. It's time to stop. Because eventually, while our hospitals are doing everything they can, there's capacity issues and concerns. Can they get enough staffing? We've said before, it's not a number of beds they can create, because we're really good at manufacturing items per se, but what we're not good is being able to train up people very quickly to be able to care for everyone that might need care. So the goal for my entire community is don't require care, get vaccinated, wear a mask, stay home when you're sick, quarantine if you're a contact, and those are things that we can actively take action on.
What's the average hospital stay for someone who's vaccinated and on the other side of that unvaccinated?
I do not have a statistic. The question was, what is the average length of stay for an individual who has been vaccinated versus not vaccinated? And I don't know, Dr. Bartlett, do you have some anecdotal that you can provide?
We know that the disease, as generally speaking, is milder in the people who are vaccinated. It's very rare for ICU stay in people who are vaccinated, and even less likely that there could be death. Does it happen? Yes, occasionally it does. But in terms of the days in the hospital, I've not seen data comparing vaccinated with unvaccinated. We know for sure that your chances of ending up hospitalized are much, much less if you're vaccinated. It's a much milder infection. You may not even know you've had a transient infection if you're vaccinated.
Dr. Bartlett, both you and Dr. Martell talked about staffing concerns at the hospital. Especially with things looking the way that they are right now, is there concerns for you that the pandemic is going to leave hospitals in a much worse place than they were than before COVID?
It's possible. Right now, we're doing very well. We're able to cover all our missions, and we're covering it very well. But if the surge were to get worse, we could begin to have staffing issues, and we could begin to have a situation similar to where we had restaurants closing, where we have to curtail certain services like elective surgery. Do I see that coming at this time? No, I don't, but it's possible. And I think the reason the mayor and Dr. Martell are talking to us now is this is the time for people to do what they need to do to prevent that from happening. And it's, I don't want to repeat everything that's been said, but it boils down to be prudent. Cover your face, stay out of crowds, and for goodness sakes, get the vaccine.
Are you seeing those breakthrough cases in people that got the vaccine really early and haven't gotten their booster yet? And if so, are those hospitalizations similar to someone that hasn't been vaccinated?
That's a great question. I don't have specific data on the people who are more than 6 months from the booster. We believe that the immunity does have some durability, and even if it's less over time, you still get some protection. But I think the data very clearly shows that if you get that booster at 6 months or beyond, it really does quite a lot to increase your immune system to even greater than it was after the second shot. And there are other vaccines, like the hepatitis B vaccine, that you do it 3 times. That is the way it's given. And there is some reason to believe that the immune system reacts best with those 3 different stimuli. So we think the magic number is 3.
Any other questions? Thank you.
See you later. Good job. Good job, Xavier.
So you're saying I'm in Chicago that day?
Yeah. So I'm going to try to work out a Teams meeting.
Is he here at the